where Ermey is like, choke yourself. Okay, you're gonna choke yourself. Hey everybody, Dr. Greg coming to you from my basement. I am going to show you my #1 prescribed stretch today. And chances are it's not what you think it is. Now, typically when people think of neck stretches, they're trying to grab their head and pull it to the side or pull it down and forward or something like that, trying to stretch your traps or your levator. We're not going for those. We're going to stretch the anterior tissues. We're going to stretch the SCM, the scalenes, platysma, and all associated fascial structures. Reason for this is all that stuff is tight. It's typically neglected, overlooked by practitioners and patients alike. And if you don't clear this stuff up, you can stretch the backside of your neck all you want and it won't do you any good. So I recommend you start here almost for everybody. All right, this is pretty simple. There's 3 basic things to affect this stretch properly. #1, you're gonna shorten the tissue. #2, you're gonna make a nice broad contact and hold the tissue in place. And #3, you're gonna move your head to affect the stretch. So in practice, this is what it looks like. I'm gonna stretch the front side of my neck here, sort of on the left. I'll shorten the tissue by looking down towards my left knee. Then I'm gonna make a nice broad contact using my index finger here. I'm gonna contact all along through here on my clavicle. Okay, so it could be above the clavicle, it could be on it, could be slightly below, it doesn't matter, this tissue is continuous. I'm gonna start slightly above, make a nice broad contact here while I'm looking down to shorten that tissue. I'm gonna back that up with my other hand, okay? Any which way you can get it in there without touching the microphone. Then I'm going to rotate my head away from my contact and then tip it away. So imagine moving the side of your head away from your hands. So again, I'm gonna shorten the tissue by looking down to my left side. I'm gonna contact around my clavicle, kind of nestle in and pull those tissues down slightly. That really helps to just kind of nestle in and just give them a little bit downward or inferior pull. Back it up. Rotate my head away and tip it back. Okay? So when you're doing this, make sure you listen to your hands. If you have a nice broad contact along this area and you feel it tighter in like one specific spot, feel free to go back to that spot and reposition your fingers and kind of isolate that one area. But again, I want you to start broad, and then if you need to, you can focus in on any particularly tight areas. Right side looks exactly the same as the left, obviously. To do the center of the chest, what you're gonna do is you're gonna look straight down into flexion, and you're gonna grab all this tissue right above your sternum here, and imagine Full Metal Jacket, where Ermey is like, choke yourself. Okay, you're gonna choke yourself. So you're gonna grab your hands like this, nice broad contact through here. I'm kind of putting pressure all through my thumb and my index finger. Look down, broad contact, nestle into that tissue, pull it down a little bit. Tip the head back, like that. And if you do that and you find it difficult for you to keep your mouth closed, it's because these tissues are so tight it's pulling that mandible down. In that case, you really need to do this, all right? Contraindications for doing this stretch would be an anterior disc herniation. They're really quite rare. If that's you, you probably know it. Another one may be facet syndrome, although even if you have facet syndrome at some point in time, you're going to want to do this stretch because likely that facet syndrome is being brought about by the mechanical changes of all this tight tissue pulling the head forward and jamming those facet joints. Everybody else, if you have neck pain, you got headaches, you need to give this a shot. Hold the stretch for at least a minute. Longer is better. 2, 3, 4 minutes. Sometimes it's kind of hard to go that long when you're actively doing this yourself. So one thing you can do is do a partner stretch. You'll lay down face up on a bed. Let your head just kind of go off the edge of the bed. We all probably remember doing this when we were kids. Let that head go off the edge of the bed to affect the stretch. Have your partner put their hand Place contact in the desired area to hold that tissue, to pin that tissue down while you move your head back and it'll stretch it. Right? As always, if you have any questions, feel free to reach out directly to me.
Now choke yourself. God damn it, with my hand!